First of all, permit me to say a very big congratulations on your pregnancy, mom. Yay! We are having a baby. Having a baby is a very serious business, and I know you already know that, and that is why you are here. Today, we'll be talking about your first trimester. That is the first 3 months of your pregnancy and how you can cope with all the strange things happening to you. Welcome to my YouTube channel, and I hope you enjoy this video. So first of all, let's start with the most common one, breast changes. By now, you may or may not have noticed some changes in your breasts. They are bigger or heavier, they feel swollen, they may be painful, hard to touch, and your nipples are probably changing in color. All these are normal during pregnancy. And here is a few tips to help you cope with it. If your breasts are swollen, they feel tender to touch, they are heavy and painful, you can just get a warm compress and apply them to your breast. Let them sit there for about 5 to 10 minutes and this will provide you with some sort of relief. You can also take a warm shower. Just go into the shower and let the warm water run through you for a while. This will give you some form of relief. Again, your breasts require good support at this time. You need to start thinking of changing all your braziers. Yes, mama, you need to go bra shopping because your breast is obviously increasing in size and your bra size will also change. So you need to buy good set of bras that would properly support your breast. They will help you take the weight of the breast off your shoulder and off your back. They will reduce the soreness that you feel. They will improve your posture and even reduce the risk of sagging over time. So go shopping today, get new set of bras that will support your breast. So let's talk about nausea and vomiting. Now I perfectly understand that this can vary from one woman to another. For some women, they don't even have any nausea or vomiting at all. For some others, it is just mild or moderate. But then there are women that have very severe nausea and vomiting in pregnancy. They feel so miserable and they sometimes question their decision to get pregnant. Don't worry, mom. If you experience nausea and vomiting, I have a few tips that can help you cope. So the first tip is to identify your triggers. You need to know what makes you nauseous. For some women, it can be the smell of certain foods. You don't want to smell them. The moment you smell them, you start to feel nauseous. Or it might be that when you eat spicy foods or greasy foods or foods that have strong flavors, you start to feel very nauseous. It might even be the smell of your soap or the smell of some perfumes or fragrances. Yes, some women can get nauseous when they smell these things. Or is it when you're hungry? Hunger can trigger nausea in some women, or when you are too full, you start to feel nauseous. The thing is, identify your triggers, know what causes you to be nauseous, and try to avoid it. If you notice that foods with strong flavors make you nauseous, you can just stick to plain bland foods like crackers, rice, or even African pap. They are less likely to trigger nausea. And again, you need to eat small but frequent meals. Now, you don't want to finish a full plate at a time. I know you're hungry, mom, but then you need to eat in bits. When you are too full, it can trigger your nausea. You will feel very nauseous. And when you are too hungry, you will also feel nauseous. So you have to keep your crackers or your snacks with you throughout the day so that when you get hungry, you will have something to snack on. Now, the trick is to stay in between. Don't become too hungry and don't become too full. And when you start to feel nauseous, you can try drinking ginger tea, or you can chew the ginger and then suck on the juice, or you can even try bitter cola. These things are known to reduce nausea. And please try to stay hydrated. Drink enough water. Because you are vomiting, you are at risk of dehydration. Dehydration can worsen the whole thing. It will even worsen your symptoms. So you just need to start drinking enough. Take your water bottle with you wherever you go to and just keep drinking and drinking and drinking. If, however, you've tried all this and you are still not keeping anything down, you are always vomiting, you just can't eat anything, you may consider getting some medications because you actually need to eat and drink at this time for the safety of your baby and yourself. So it is not a bad thing if you go to see your midwife or your doctor and then get some medications that will help you get by. You'll be fine, mom. You will be fine. Now, let's talk about fatigue. I know that you're tired. At this time, you just want to stay in bed and sleep all day if it's possible. You don't want to do anything. Now, this is how you can cope with fatigue. When you start to feel very tired, listen to your body. Drop whatever it is that you're doing at that point and go to bed. Go and take a nap. Even if you are at work, take a break. Now, if you want to keep pushing and you want to keep going even when you're feeling very tired, you will only feel more tired. But getting that break or taking that nap will give you a bit of energy. So when you start to feel tired, take a nap, take a break, and then come back to what you were doing. Let's talk about the mood swings. Oh, at this time, your emotions are all over the place. Your hormones are raging. You don't know what is happening to you. This minute, you are happy, you are lively, you're playing, and the next minute, you are sad. You are even crying. And when someone asks, what is the problem? You don't even know what the problem is. It is just your hormones playing up. And this is how you can cope. Learn to talk about it. Communicate with your friends, your family, your partner. Tell them about your emotions, your needs at this time. And this is why I advocate that you marry someone who loves you enough and who is kind enough to understand that you are not acting up at this time, so that he will be able to support you and give you all the support you need at this time. Again, when you feel those emotions coming in, you can try to engage in activities that you like. See a movie that you like, play some music, dance to some music, take a walk. These are ways that you can cope with the mood swings. Anxiety and uncertainties. You are going to have a lot of questions, especially if this is your first pregnancy. You are going to ask a lot of questions. Oh, why is my pee yellow? Why do I have that mark in my belly? Am I supposed to eat this or eat that? Is my baby all right? Am I okay? Is this? It is okay, mom. It is all right to ask questions. Now, this is what you can do. Educate yourself. Arm yourself with the right knowledge. Talk to your doctor, talk to your midwife, read books on pregnancy. Subscribe to this channel because here I'll be dishing out pregnancy content that will help you get by. Now, doing this will help you understand this journey better, help you understand what is happening to your body and why it is happening. And if you're having some issues in pregnancy, like threatened miscarriage or a high-risk pregnancy, and it is making you to worry, instead of you to worry about it, if you believe in prayers, pray about it. Speak positively to your body. Your body is doing what it is meant to do as a mother, and you will do it perfectly well. Speak to your baby. Two of you will come out of this victorious. Connect with other pregnant mothers. Share your tips, share your experience. It will also help you get by. You can also practice relaxation techniques if that helps you. You've got this, mom. You've got this. Thank you for sticking with me to the end of this video and see you in my next video. Bye.